it, and I really encourage you to go and read the blogs.
Hands on it and say, yes, we can change something.
I'm Vice-President Vice-President yes, with the Ontario Nurses United. Thanks for coming,
The fact is that Ontario is the lowest funder of hospitals in the country. So what that means is Ontario hospitals receive the lowest amount of funding per cap than any other province. Things have changed for us as nurses and began to change in the 90s. Thousands of nurses were laid off under the PC government, if you well remember, and we are only as a nonpartisan organization, but this is factual information, and I'll be giving you some of that as I go through my notes. I worked through that time in the 90s when hundreds of my colleagues in a large hospital in London were laid off, when we lost hospital beds, and when new graduates could not get jobs. We're an aging workforce today in 2011, as we have been for almost a decade now. The average age is 47, and that's our average age. We need to be sure that the funding is there and that the nurses are there at the bedside and involved. Our politicians are talking lots about different programs, and you will continue to hear more announcements, I think, leading up to October 6th. You'll hear about new hospitals, you'll hear about new programs. But what we need to hold their feet to the fire to make sure that they understand what the priorities for nurses are. And those priorities are that we have adequate care provision, we have registered nurses on the rise, not on the decline, that we don't continue to leak and lose our registered nursing students who are graduating. University of Windsor graduating class this year, over 80% of them were going across the border to the States to work. They weren't staying here in Ontario. Listen carefully to what the candidates say. Ask them for detail. It's always easy to say that I will do if I'm elected, but it is about the details of how that'll happen. Vote on October 6th and wear buttons.
Our history, both recent and remote, is filled with examples of nurses who understand how political decisions affect our work environment and client safety, giving nurses power to continue to speak out for health in its broadest sense. It is not difficult to see how acting on a political level is a natural extension of the essence of nursing. It actually demonstrates care. I urge everyone in this room to make a commitment to share the information learned tonight among their families, friends, and colleagues. Everyone in this room has the power to make a difference.